super excited to have so many of you here for this legislative update. And we're happy to have Deb Miles here, a graduate of the program, to come and share what she's up to and how her work, the work she's involved in, is really going to impact you all as social workers. So I'm going to hand it over to Jennifer to do an intro for herself. And there are snacks and water at the front if you haven't already helped yourself, so please do so. Thanks.
All right, thank you. Hi everyone, how are you doing? Yeah, a little bit of a dreary day, right? Well, I'm glad that you all are here. Can you also hear me? You feel like a small enough group that I'd rather just talk to you like this than use the microphone. But please let me know if you're having trouble hearing at all, and I'll speak up a little bit. So my name's Jennifer Miles. I graduated from this program in 1994. So it's been a while ago now. And I like to tell people that I was pretty young. I went straight from college, so I was only 24 years old when I was ready to graduate from this program. And I remember in my field placement, I felt like by the time I saw the 10th person with the same problem, I wanted to know why someone wasn't doing anything about the problem that caused people to be in that situation in the first place. So I decided that I had more interest and a lot of talent in the area of working in policy. So I decided to do more of that. So ever since I left here, I've worked in what you would call community or indirect practice with a lot of work in policy. I left here and got a job right away. This is probably going to really date me, but I found my job in the Denver Post want ads, and I applied for it, the actual newspaper. Yeah. I applied for the job and found that the woman who was leaving the position had been a graduate of this program, and she had also done her internship with the same field supervisor I had at the time. So while I just sort of applied a little bit blindly out of the newspaper, it turned out I had quite a connection related to this school, and they hired me before I even graduated. And it was wonderful. I worked at the Colorado Community Health Network. It's a state association of community health centers, and I was the director of public policy when I left there 9 years later to start my own business. And I started my own lobbying and government relations firm called Miles Consulting. Now that's been 9 years ago. And I started by joining another lobbyist and thought that I would enjoy working on more issues. He worked on water issues, credit unions, Great Outdoors Colorado, open space. But I found that while I wasn't opposed to any of those issues, I didn't have the kind of passion or interest in them that I did in health and human services. So my lobbying firm really is a specialist in that area today. And in addition to myself, who's a graduate, I have 2 other graduates of this program who work for me today. So we're 3 social workers in 1 lobbying firm, and Rebecca right here is one of them, and she graduated from this program not just last year, 2012. And Diana is kind of in between us. So we're 3 social workers doing lobbying down at the state capitol here in Colorado. What I put together for you guys today is a presentation about policy impacting social workers and your clients. And I wanted to start by getting a little bit of interaction from you guys before I go to the first slide, which has some of the answers. So I'll see if you guys can come up with them first. Tell me about some of the policies you're aware of that impact the practice of social work. Can you guys think of any laws that impact your practice? Licensing, okay. So who can be licensed and what the requirements are for licensing? Yep, that's a definite category. Anything else you can think of about the practice of social work? Mandated reporting for, are you thinking about elder abuse and neglect? Great, okay. Any other thoughts on laws that affect social workers in their practice? Child abuse as well, okay. So it's interesting. I put things into 3 different categories. The first being the types of policy changes that impact social work, the practice of social work. Who can practice and what can they do? We have in the state of Colorado something called the Mental Health Practice Act, and that describes those kinds of things. In that law, we also have who can call themselves a social worker, which is called title protection. And you have to, you may not know this, and it hasn't been the law that long in Colorado, but you have to graduated from at least a bachelor's in social work program, accredited nationally, to call yourself a social worker. That's something that is not done correctly sometimes, but that is what the law is. The law also covers what social workers are required to do. What kind of mandatory disclosure do you need to give to a client the first time you work with him or her? What sort of continuing competency requirements are there for you to keep your license in the state of Colorado? And what are social workers prohibited from doing? What are considered unethical behavior, and what are the disciplinary procedures? How can someone actually lose their license? So there's that category. And then we go beyond that to policies impacting programs that employ social workers, okay? So there's where we get really into some of the child welfare issues, elder abuse, and so forth, and I'll talk about more of those as we go through. And then we have a lot of policies impacting social work's traditional clients. So mental health crisis funding, Medicaid expansion, oh, there it goes. And then the more general policies that uphold social work values. And we'll talk about some more of those. So the interesting thing is when you go to look at what happened in 2013, there is an incredibly long list of things in those three categories that passed in this last year. It was a very active, very busy year. So I don't want this presentation to be just a laundry list of what those are. I'm going to talk about them very briefly and then focus on a few of them a little bit more and dive in more as to how social workers were involved and so forth. Is that a battery issue, Linda, or do we know? Should we plug it in just in case? Okay, so I called this first category long-awaited successes. We passed bills related to civil unions and extending the Family Medical and Leave Act to people in civil unions. The asset bill passed after many attempts, allowing undocumented high school students to pay in-state college tuition rates if they finished high school here in the state. A Colorado earned income tax credit and a child care tax credit passed for the first time after many, many attempts. And a lot about gun control. Interestingly, there was a bill to create a task force to analyze whether persons who are harmful to themselves or others can get guns, and that didn't end up passing. The task force was never even set up. There was a lot of controversy around saying that people, even with certain types of mental health diagnoses, should just not have access to guns at all. Our gun ownership society. Well, and also a lot of people in mental health were concerned that people who really believe strongly in gun ownership or own guns themselves might be afraid to seek mental health services. So that was a very interesting discussion, and we'll see if it comes back. Now guns are kind of a toxic issue this upcoming year. All right, so some of the other things that happened. A lot of mental health victories, starting with funding. So for the first time, the Medicaid substance use disorder benefit was expanded significantly. It has been criticized in the past for not being able to meet all of the full treatment needs of someone on Medicaid. And these, of course, are folks that are very poor and don't have another way to pay for treatment. $2 million was put into a jail-based restoration program. A number of different modalities were expanded through additional funding. And the big issue here was that $19.8 million was given by the legislature, appropriated, to create a behavioral health crisis response system. And I'll talk a little bit more about that as we go forward. So this, I have to tell you, historically, with all the years I've done this, is the most money and attention that mental health has ever received in a session of our state legislature. Because we keep going. The $19.8 million that I mentioned is creating a statewide coordinated behavioral health crisis system, and it's going to include all of these things. Now, you might look at that and say, social worker jobs. You might look at that and say, thank goodness my clients need those things. Whichever way you look at it, these are pretty major things that are going on in creating a system in our state of Colorado that hasn't existed before. Also, a bill that was going to change the civil commitment laws about holding people involuntarily for either mental health issues, for alcohol or substance abuse, was turned into a task force at the end of the session that is now studying and working on recommendations that will happen in the next legislative session about how that's changed in our state of Colorado. We have had 3 different laws for those 3 different types of civil commitments: mental health, substance, and alcohol. There's been some attempt to try to see if they can be brought together and made into one law. And the conclusion has been in some ways yes, in other ways no. So it'll be interesting to see the recommendations that are not final from that task force yet. And some additional funding was given to the Fort Lyon, a former prison facility, to be a new transitional housing unit for the homeless. So a lot going on. And then we switched to child welfare, which was an even busier year. Now I will say I squeezed more onto one slide. It's only one slide, but it looks kind of busy. The other, behavioral health, of course, was 2 different slides. But there was a 15% increase, $22 million additional dollars to the Department of Human Services Division of Children, Youth, and Families for these things outlined here. Again, social work jobs, good for our clients. And I don't know if anyone still reads the newspaper, but on Sunday there was an article about the abuse hotline. That's the first one that's up there. It's in development right now. It's supposed to be implemented January 1 of 2015. But as you all know, as you can imagine, this stemmed from a lot of the media attention in the Denver Post and elsewhere about cases that have happened in the state of Colorado. This hotline, as they talk about in this article, they're thinking about all kinds of things, like the people who answer the phone will not be brand new caseworkers, but rather more experienced ones. That every case, every call that comes in will actually get reviewed by a group of other people, so that one person doesn't have the ability to say, no, this case doesn't warrant looking into further. Those in the county who get the statewide hotline phone calls for their area will be able to look and see if the family has any history with the child welfare system, so that they consider that when they're thinking about the call that's been made to them. So I wanted to talk about that one a little bit more, but that's a major change. Rebecca, who works for me and who used to work in child welfare years ago, reminds me that this was an idea that came from caseworkers and people who'd worked in child abuse and neglect for years before it finally moved to this level and got funding. Partly because people realized that we were in a little bit more of a crisis situation perhaps than was seen before by people because of the media attention to some of the specific child abuse cases. So your input does matter. It can influence those kinds of things being developed in the first place and funded, and then also how they're implemented and how they work. You're fine. Some of the other things, and this was something that we had some influence in, but some others as well, is the second item on there, a caseload study to evaluate working conditions of caseworkers. What is a feasible caseload for people to be able to do a good job? There's some research and thoughts about that, but that is something that we're going to be looking closer at in Colorado and seeing if there need to be any changes in how we do things here in our state.
I'll just add one piece about that. There's actually, I was just working on this over the weekend, there's no data in the state of Colorado. We're one of 11 states that's not reporting federally because we have 64 counties running our child welfare system 64 different ways. So there's currently no data that outlines what that number is and what defines a caseworker or what a caseload is. So it's just one of the outlining flaws of the current system. And NASW, the National Association of Social Workers, participated in an audit over the summer that I was part of, so that the folks who were hired by the state could come in and talk about the caseload size, what that looked like, and so on behalf of social workers who are also caseworkers, they were sharing stories. So it's just another way that is impacting the work that we all do.
Another thing that happened this year is the creation of local child fatality review teams. And this was a very interesting thing to be part of. This was actually like the merging of public health, if you will, and social work in a lot of ways. But basically what will happen is each locality has to establish, and they can join with a couple other counties, so they can have regional ones, but they have to establish a child fatality review team. That team is multidisciplinary. It includes law enforcement, it includes social workers, it includes a lot of different people in the community who will review every case where a child died of a preventable issue. So they're not going to be looking at cancer deaths of children, but any preventable issue. So that would include, of course, child abuse and neglect, but it goes broader than that. Some of the examples that were given is, the 16-passenger vans that were used to transport kids from schools and other things. There's an accident in the community. The Child Fatality Review Team looks at that and ends up making recommendations about the use of those vans for kids and their safety. There's not abuse and neglect in that case, but children died. So that's one example. They also hope to look at things more in depth, if you will. So if you do take child abuse and neglect, I think we all know that one of the trends that has happened that people have seen is that it can be the mom's boyfriend or a stepfather who ends up oftentimes being the one who commits the abuse on the child. So what is it that's happening for those women with the men that they're with? Is there something that needs to be done for those men to make sure they have good employment, to make sure that they have opportunities to address any substance use issues? And so what are the trends that might be happening there if that is often the perpetrator of the abuse? Those are just the kinds of things that were talked about with these child fatality review teams. A place for social work to be involved, but a place for other multidisciplinary type approach to occur as well. And finally, going back to mandatory reporters, you mentioned it for elders, the child abuse and neglect list of mandatory reporters, people in state law, if they see or think they see abuse or neglect, need to report it. The list of people was actually expanded to include emergency medical service providers, EMTs and paramedics, sports coaches, assistant coaches, and others involved in youth sports. And then we get to the major bill about mandatory reporting of abuse, neglect, and financial exploitation of seniors, age 70 and over. And that bill included some specific funding related to caseloads and reducing caseloads for those adult protective services workers who work with at-risk adults. It also provided some training and quality assurance activities and implemented a data collection system. So it wasn't simply adding a new category of mandatory reporting for all of these people. It's more than that. It's a whole system to respond to the needs of those who are reported. And this has been a long time coming. Colorado is actually, until this passed, I think one of, Betsy, you might know, 3 years. I was going to say one of 3 states that didn't have a similar law in place. We did end up doing 70 and older. I laugh a little bit about why. It's because the main senator behind it is, what is she, 69, 70, and she says, I don't think I'm that at risk. So she felt like the age of at risk was getting older. So also, it costs less money to start at age 70 for the system and the mandatory reporting. So it was fascinating to see how finally we had some money in the state of Colorado. The previous bills doing this had failed because there was no money to do any investigation. So why require people to report if you can't do anything to see if the seniors are at risk? There was finally some recommendations made about adequate funding. So those are some of the ones I wanted to focus on a little bit more. You can see some of the other things up here that were of interest to social workers: reducing the waiting list for people with developmental disabilities, senior services, offering breakfast in certain high-risk schools, updating sex ed in public schools, all kinds of things. A couple of others that are kind of in my laundry list that I'm not going to spend as much time on, but were of interest, is expanding Medicaid so that more, especially adults, will have health insurance who've been uninsured. Adding 12-month continuous eligibility for kids, so once they're on Medicaid, they can be on for an entire year. That hasn't been implemented yet. It's supposed to start in April. There was a 3-month waiting period for the child health plan where kids literally had to be uninsured for 3 months before they could go on the program. The idea there was to stop people from dropping private coverage to go on a public program. But in reality, and real people came and told their actual life stories, it was forcing people into a decision of dropping health insurance they really couldn't afford, having their kids go uninsured for 3 months, hoping that nothing major happened, and then being able to get on the program. Adult dental benefits. How many of you have worked with an adult on Medicaid who the only option is to get a tooth pulled? So they're trying to become self-sufficient, trying to get a job with missing teeth. That's going to change starting in July. So the adult dental benefits are being designed now. They're definitely intended to include more restoration and trying to save teeth, or doing something to replace those false teeth at least. A new sex assault victim emergency program was passed to help those with medical bills. We're having some more technical issues. Oh, it seems to always come back, right? Yeah, okay. And I think this one is kind of interesting. Are any of you experienced in any way with working with needle exchange programs for drug addicts? Okay. So the law in Colorado had been that if you worked at or were a volunteer with a needle exchange program and you were found by the police with drug paraphernalia, you couldn't be arrested. It was expanded this year to participants. So if you're participating in a program and the police find you with needles, you can't get arrested. Now if they find you with heroin, of course you can get arrested. This was just for the drug paraphernalia itself. Whoop. Now what did I do? hit the wrong button. All right, so I wanted to go into a little bit about what's happening now. And we'll definitely have some time for some discussion. So if you guys are seeing bills that you want more information about that I'm going through quickly, we'll have questions, answers, and some discussion at the end. So keep that in mind. And if you have a burning question while we're there, I'm happy to take them at the time as well. So what's happening now? The Behavioral Health Crisis Response System is getting created. The state put out a request for proposals and asked anyone who is interested in applying to submit a proposal about how they would use the $19.8 million, meeting the requirements of setting up the crisis centers, the hotline, the respite services, and so forth. And I heard recently that that was awarded at the end of September, maybe the beginning of October, to a group that came together just to respond to that has worked in Colorado and some other states. I have heard that there's some concern on the part of people who have been running mental health services in Colorado for some time about whether this out-of-state group that came together is going to be able to do this and do it well. Someone's nodding her head in the back. Have you heard about it? Yeah, I think there's a little bit of controversy over who was awarded the funds. And so there's definitely folks watching. The child fatality prevention review teams that I mentioned have to be established, they're required by January 1 of 2015. I know of many local communities that are ahead of that schedule and are hoping to have them established sooner than that. They do review child deaths that occur at least a quarter ago, if not 6 months or more ago. So it's not any part of a criminal investigation. It's more looking at trends and whether they should make any recommendations to avoid future child deaths. The child welfare changes are being implemented, which the newspaper article talks about. Medicaid gets expanded January 1, the 12-month continuous eligibility for kids, and the adult Medicaid dental benefit are all starting in the next year. Oops, I went the wrong way. So what's coming next? What do I see that's coming for the next session? Right now, if you guys, how many of you are registered voters here in Colorado? Okay. Did you turn your ballots in yet? Yeah? Anyone who still needs to do it? Yeah? All right. You got a little more time. A couple of things that are on there. There's a K through 12 education tax increase. You've probably seen the ads for it if you've been watching TV at all lately. I would encourage you to read your ballot information and learn more about it. The tax increase has been pretty well directed in terms of where it can go, and it's definitely 2 schools, 2 classrooms, 2 services for kids. There's also a retail marijuana tax proposal, both a statewide proposal, and if you're a resident in the city and county of Denver, there's also one for Denver. The statewide proposal is actually the funds would go towards school construction and other general uses. The Denver one is much more targeted, and it actually includes specific activities related to education about the use of marijuana, especially among youth, and substance abuse services for the community of Denver. So take a close look at those. Of course, there's some debate about whether you tax the product too much and people will just still buy it on the black market. So that's an interesting debate, but that'll be on the ballot. And then our legislative session in Colorado starts in January. How many of you have been down to the Capitol before? Okay, so a pretty good number of you. We hear that the Republicans are going to bring all the gun bills back to try to get them all repealed and to try to get people on record as to how they voted going into the fall elections. That was incredibly controversial last year. Every time a gun bill was heard, the Capitol was filled. Those of us who work there on a daily basis could hardly get in and out of the building. And it's just, people have very strong emotions about these topics, so that'll be back. As I mentioned earlier, the civil commitment or holds for mental health and substance use, the task force is making recommendations, and we anticipate at least one, if not more than one bill, to change how that process works in the state of Colorado. How many of you have heard of SPICE, or synthetic marijuana? Okay. There are groups of people looking at a spike in emergency room visits as a result of this drug that is very easy for people to get in drugstore type situations. It's not actually technically illegal at this point, so there is some, and it's not really actually marijuana. But there are folks talking about what, if any, law changes need to be made in the state of Colorado to reduce access to this substance, I guess you could call it. More on child welfare? We don't know for sure. Some of those caseload study and things may result in more, but also the continued newspaper articles about cases. The most recent one, of course, here in Denver with the 3 boys are leading to legislators still talking, still thinking about, have we done enough yet in child welfare? Is it okay to let some of the things we decided upon get implemented, see how they go, and do more if we need to, or do we need to do more right now because things are still not going well for kids? So it'll be interesting to see how that turns out and what bills get introduced. Okay, I kind of crammed a lot onto this slide. There has been a group meeting called the Economic Opportunity Poverty Reduction Task Force. Are any of you familiar with that group? No? Okay, so this has been a group of legislators and other stakeholders who are interested in basically poverty issues. And they just voted a couple weeks back to bring forward all of these bills listed on here. So, how people can get state-issued IDs. If you don't have a state-issued ID, it's very difficult to get benefits and services. That should actually say aid to the needy disabled. I missed a D there. A program that we have in the state of Colorado for people who are so disabled they cannot work, returning their monthly benefit to pre-recession levels and tying it to federal poverty and letting it grow over time. This is a program, I don't know what the dollar amount is today, but I think it's around $200 a month that you're, $175? Okay, so I was close. So about $175 now for someone who's too disabled to work. Hardly enough money to live on. Some adult education programs, child care tax credit, child care assistance, affordable housing, and some changes to the tax and rent heat rebate program. So some great poverty-related bills that are coming out, a good package of them, I think. Oops, I keep going the wrong way. No. There we go. Okay, so how can you as social workers be involved in all of this? There's a few key ways that I put up here. Join your National Association of Social Workers. While you're a student, it's relatively cheap. Yes, it's very expensive in that first year after you graduate. I would still encourage you to be involved. Now, I'm a little self-interested there because your membership dues support lobbying, and I'm the lobbyist along with Rebecca and Diana for the Colorado chapter. But social workers having a voice in these policy issues is only happening because of that. You can join the legislative listserv and just get emails about the bills that are being followed, when they're going to be in committee hearings, and when the legislative committee meets. You can also be a part of the legislative committee, which meets over the lunch hour on Wednesdays. And then what is it, the second and fourth?
Second and fourth, I think.
Second and fourth Wednesdays over the lunch hour. There is conference call capability. Usually people come in person, but there is the ability to do a conference call. And that's where a group of social workers get together and talk about the bills that have been introduced and what the National Association of Social Workers Colorado chapter's position should be on those bills and which ones their lobbyists should work on and really get priority. So it's a great way to be involved in that. Another group that Rebecca reminded me of is the Colorado Social Legislation Committee. Are any of you familiar with that group? Okay, they meet every Monday during the legislative session over the lunch hour. And their topics are all the ones that we went over plus more. And it's a great way to network and meet people and see what organizations are involved in what bills. And they also take positions on bills. And if you're a member, which I think is only $15, $5 for a student, and you go to the meeting, you get to vote on what their position will be on bills.
And also bring forward, if you're working on legislation, you can bring forward ideas and help folks hear it and vet it. It's a really, really great opportunity, I think, as students. I've met many of my mentors from that, and Jennifer and I connected partly through that. Maybe and I now have jobs, so.
You don't even have to be a member to go to the lunch.
No.
But you can sign up on their website just to get their emails about when their events are. And you can separately decide if you want to join or not. But yeah, it's a great group. And join other organizations and committees that are advocating for issues that you care about. You may find out about those through your field placement or through your employment, depending on your situation. So there's a lot going on now. I hadn't given this presentation before. It went faster than I thought. We thought it was going to be long, right? There's a lot of stuff in these slides. So we have lots of time to talk and hear questions. Do you have something? Oh, I thought I saw you put your hand up. Okay. Yeah.
Can we talk more about the expanded
Yeah. And let me ask, for the purpose of the recording, do you want me to repeat the questions I get, or can you pick them up?
I can.
Okay.
Yeah.
Okay, so she was asking about the Medicaid dental benefit for adults, and it will apply to all adult Medicaid categories, including those new expansion categories that start January 1 of 2014. As I mentioned, the benefit is being designed now. I don't know if you're familiar with the children's Medicaid dental benefit. It's considered a very rich benefit package. The adult package will not be as rich, but they're trying to get the most bang for the buck that they can. It's worth about $1,000 per year per person. On average, that's an actuarial rate that they'll have to try to figure out what package of services equal about that amount. And it won't be implemented until July 1 of 2014. So those adults who are on now, and even those who come on in the first 6 months of the new expansion, won't be able to get those benefits until a little bit later down the road.
Well, are they going to need to do some kind of notification around that once it's decided? Like,
Yes.
this is added in or something?
Absolutely. And I think they're still working on how they're going to do that. The communication from the Medicaid agency to patients gets criticized a lot. People get confusing letters, lots of letters. And so I think that there will need to be some communications effort on the part of others who work with Medicaid patients, including their healthcare provider, making sure they know that they can also get dental care and helping them find a place to go and get that. But also others who work with low-income adults who may be Medicaid eligible. And in particular, if you're helping a Medicaid adult or someone who may be eligible apply and try to get on the program, to be able to talk to them at that time about the fact that they'll be getting a dental benefit and tell them how they can go about using it. There are also attempts underway to recruit more dentists to participate in the Medicaid program. And of course, without an adult dental benefit, a lot of dentists who saw primarily adults didn't see any reason to participate in the program in the past. So hopefully they will now see a reason to participate and be available providers. Yeah. It's, I mean, the stories that were told during the testimony, which makes a big difference in what happens, whether these bills get passed and whether they get funded and so forth, was definitely about people who had a toothache or problem, and really the only thing the dentist could do, because they didn't have any money and they were on Medicaid, is extract the tooth. And that these teeth are savable often. But it not only was their only option to extract the tooth, but then they didn't have any way to give dentures or partials or anything to make the person look like at least they had a tooth. So it's been a long time coming.
Yeah, that's pretty big.
Yeah. What other kinds of questions do you guys have?
Can you talk more about, I think it was called drug endangered children?
Oh, yeah. So I might have Rebecca do that because you were more involved in that. Or do you feel like you were? I can start if you want to.
Yeah.
The drug endangered child, it did come up very, very late in the session. And it was from Senator Linda Newell, right? Or she? Okay.
She started off, Senator Kerr, Andy Kerr,
Right.
is who ended up running it. He is a big advocate of education and anything that has to do with education, child welfare system. He's got one of his own. And then Julie, Allan Jensen,
Yeah.
that group is who actually did the whole thing.
So what they were looking at was trying to determine if a child is drug endangered and should be removed from a home as a result of that. So this is related to right after labor and delivery, assessing whether there are drugs in the baby's system, but also other things that might indicate that a child was drug endangered, and trying to develop a definition for that that would be used to make determinations about children and whether they should stay in their home or be placed elsewhere and so forth. So it's a little controversial because, you know, do you keep people from coming in to deliver a baby because they're afraid the baby might get taken away? Do you keep people from seeking services during a prenatal period because they're concerned that they will get arrested or something will happen to them? It's a delicate balance. At the same time, nobody in a labor and delivery unit wants to send a baby home if they can very clearly tell that there's some danger for this child.
They were trying to decide if they should include pregnancy as part of this. There are many states out there. I've worked in one where that is included, and there can be some real benefit. Colorado is set up in such a way that there's a lot of hesitation around making large changes like that for a lot of reasons, stemming back from many, many, many years. So that was one of the big issues. And the other issue was that they didn't know where to put the law. So if something like that were to pass, they didn't know if it should be included in the children's code, which something like that already exists to some degree. And then they didn't know if it should also or otherwise be put into the criminal code. So there was a lot of legal stuff going on that was really difficult to follow. And I'm not even sure where it's at right now.
I don't either.
I know that it's still, there's a task.
If you want to email us, we can find out more about it and send you more information, but I'm not sure, to be honest, where it is right now.
There is a task group, and it is open, that you would be able to participate and sit in on a meeting or call in if you wanted to, I'm quite sure. But yeah, if you give us your info, I can send you information. I know the people who are running that. I also know NASW is a part of it, so they've been watching it very closely.
But just backing up a little bit, oh, go ahead.
Does that include alcohol?
I think it was supposed to, but they were trying, I think that was one of the debates too.
Yeah, it all stemmed from some of the discussion around marijuana and what was going to happen, and which is how Senator Andy Kerr got involved with it, because he was concerned about the message that was going to be sent through education systems, et cetera. And then it totally transformed and morphed into something different, and because it was so late at the end of session, it was literally like the last week or two of session. And so whatever was decided and determined, it still has a lot of stuff going on.
But backing up a little bit, just some of the things that Rebecca said prompted me to think about talking to you guys about. What she was talking about there is simple things like, does this new law that people are proposing, where does it go within our state laws? And what are the implications if it goes in the children's code versus the criminal code? Those are things that we as social workers don't know a whole lot about when we go into a policy-making environment. There are other people, attorneys, who have knowledge and can help with that guidance. At the same time, once you get a basic understanding of what that means to have something in the children's code versus the criminal code, I think it's really important that social workers have a say-so in that. So does it make sense based on your experience for a woman who comes in to deliver a baby who has drugs in her system, and whether they show up in the baby or not, is arresting her and having her go into the criminal system at that point in time the best thing for her? And that's where social workers can have an input. If it's in the children's code, then that woman is more likely to get services for herself and her child, not have a criminal record, not go into jail or prison when she has a newborn baby. That really bonding with that baby is perhaps more important at that moment in time than arresting her for the drugs that may be in her system. So having a basic understanding of some of those things can lead to a lot of really good input from social workers.
The issue with some of these controversial topics that I've seen is you get a lot of people with a lot of different self-interests or professional interests together at the table, and it's really challenging to find common ground. So you'll have hospitals that want one thing, and then you'll have clinicians who see another thing. You've got state or government folks or funding sources saying another, and so it's to be a little convoluted and challenging in terms of sometimes making sure that the best interest of whatever it is you're talking about is maintained. So.
And then a lot of the work that we do, there will be other mental health professionals at the table. Psychiatrists, psychologists, licensed professional counselors, addictions counselors. They all have their own lobbyists and in some cases their own interests. So I thought I had a slide in here about some changes to mental health. I might have skipped it or maybe it didn't print out. Wait, hold on. Oh, let me go back to the slide that I hope is still at the beginning. Oh, I skipped over this one entirely, so I'm going to go back to it right now because it builds on the point that I was just making. Mental health professionals in our state, all those folks I listed, actually psychiatrists are different. They're under the Medical Practice Act, and the law that governs them is the same law that governs physicians in our state. But the others that I mentioned, psychologists, social workers, licensed professional counselors, addiction counselors, marriage and family therapists, LMFTs, and we used to call them unlicensed psychotherapists, but now they're registered psychotherapists, are all in the same law in the state of Colorado. And as you know, each of those professions look at things a little differently. There's definitely commonality, but there's definitely a little difference about how they look at things. So a couple things that happened this last year. There were requirements in the state law that those mental health professionals with a new client disclose to that client their training and their background and how someone can complain if they have something go wrong, both in writing and orally. What was happening is people were finding that they would spend much of their first session with a client going through this disclosure. And so we advocated with other mental health professionals and social workers work to get that changed so that there is still a written disclosure so that everyone receives that, but that you're not taking the time that that person's coming to their first session, potentially in crisis, paying for it, going through and repeating basically what's in writing. So, and then there were also some changes made to the mental health professional peer assistance program. So this is a program that was created a few years back. It's been in place in our state for physicians and nurses and other types of professionals for years. It's really meant for that social worker with a license who has an alcohol or drug problem. And it's meant to try to address those problems, get them into treatment, keep it from affecting the care that they're providing, potentially put their license on hold during that period of time while they're getting treatment, assess whether they're ready to have their license reinstated or not, and figure out how to handle that. The state of Colorado is going to be contracting out with an organization to provide those services. These other ones I think are interesting. So licensed psychologists came forward with a bill to allow them to do mental health evaluations on defendants. Prior to that, only psychiatrists could do so. There is definitely a feeling among the social work community that there are some forensic social workers with the right kind of experience and licenses who are capable of doing that work as well. They introduced a bill with what we call a very tight title. In Colorado, this is different than in Congress. The title of the bill, everything has to fit in within that title. Unlike in Congress where you can add amendments to bills that have nothing to do with the title, it has to fit under the title here. So they introduced the bill with psychologists performing mental health evaluations, so there was no opportunity to amend the bill to add social workers. We would have had to bring a separate bill to do that. But that was interesting. Sometimes there's a little bit of a turf war, even if you will, or turf issues, not necessarily a war, but turf issues among the mental health professionals. And then this one here allows persons licensed as physicians or psychologists in another state to treat persons with mental illness at a federal facility here in Colorado. But just psychologists and physicians. So these are some of the conversations that we get into on behalf of social workers that may affect your profession differently. Sorry that I passed through that, but other comments or questions or thoughts?
Can I go back to the mandatory reporting of job reviews?
Absolutely.
This is another way where social workers can be involved. We have the Colorado Chapter GSSW has a committee on aging, and we are tasked with figuring out how we're going to make sure that all the social workers in Colorado, it's not just social workers working on the job, but all the social workers are familiar with mandatory reporting, and we'll be working on that in the next few months.
That's great to hear. It makes me think, too, that it's good to know that the chapter of NASW here in Colorado has several committees based on interest areas. So the aging committee is one. There's a health committee, child welfare. I probably don't even know about all of them. There are also regional groups, like the Denver region will have happy hours and other types of sessions regularly. So it's a good way to be involved with some of your social work peers and to find out what's going on in your area of interest. Yeah.
Can you touch on some of the details around what they were talking about with the gun rights as far as the mental health aspect of it? If that's, I mean, you said that was probably coming back into play next session, so.
Yeah, I'm not sure if that particular issue will come back into play, but you think it will? Yeah.
In some form.
So the concept was that people with certain mental health problems shouldn't have access to guns, and that we should find a way through our policy to limit the access to guns of someone who could potentially commit a crime because they're mentally ill and might harm themselves or someone else. And honestly, initially it was more about or someone else that people were concerned about. I think it was mental health professionals, including social workers, that brought in the harming themselves through suicide or other things with firearms. But that wasn't where it came from initially. So the debate was really around whether that can be done. Okay, so I think for many of us that probably seems like a good idea. But it's also true that all schizophrenics are not violent to themselves or others. So it became very difficult to say, are there specific mental health diagnoses that we would identify as someone who is diagnosed, goes on some kind of registry and can't go and buy a gun? Is that an invasion of their rights to put them on some kind of registry to keep track of people with certain mental illnesses? There also is debate about how long someone stays on that list and is not allowed to have, to be able to get a gun, and who determines that. So all those things were being debated. And then, folks that advocate for people with mental illness, the National Alliance for the Mentally Ill, whose members are either have mental illness themselves or have family members with mental illness, they came forward and felt really strongly that this was not good to put people with mental illness on a list that they can't get access to guns. And then, of course, what I said earlier was also discussed a lot, which is, will people be afraid to come get mental health services if they hear, oh my God, don't go see a psychiatrist, you might get put on this list and then you won't be able to keep your guns, or you won't be able to get a gun. And so there's already a bit of a stigma around mental health, of course, and getting mental health services, and I think it's come a long ways in the last 5 or 10 years, but was this potentially pushing that backwards, especially for people who believe in or own guns? So it was a fascinating debate around how you take an idea that makes some sense and actually put it into policy in a way that has the outcome and doesn't have unintended consequences that may hurt people more than those with the initial idea came up with.
Did they talk about what they were considering? No. It was just the other big piece that they were talking about was the word probability. So how can you, what would the liability of a clinician, what would that look like for someone who's determining the probability that somebody would become violent and hurt somebody? And so, there's a lot of research out there, and with all the shootings that have happened, I think Allan, the Colorado theater guy, is the only one that has been tied to any mental health services, and his plan was never stated to his therapist. So would that have even impacted that decision or whatnot? And the therapist took a lot of heat for that, but she theoretically, she followed the rules, she did what she was supposed to do, she still took a lot of heat. So there was a lot of discussion around, if you use the word probability, how can anybody determine what the probability is that somebody's going to help break down to that extent? That level of destruction is almost impossible to account for. And I think even somebody committing such an act would probably perhaps have a difficult time. So the legislator who was bringing this forward, she has the most, she has, the best interest of people at heart. She's led a lot of really great bills, and so we recognized her in their annual event last year and honored her. And so it had nothing to do with not wanting things right or being malicious. It was simply just the complexity of that. You can't take a word and change it to that extent necessarily without having, intentional discussion around these sorts of things.
And I'll say in the legislative hearings, I didn't hear talk about which diagnoses, but in some of the pre-work of people who got together, including some of the mental health professionals, it was discussed in the context of not everyone with schizophrenia, and so that's where some particular diagnoses came up. But it was more to talk about how there's not one category of mental illness that you can say these people are probably going to commit some violent act.
And also, what would you do when, who would be utilizing the resources to then go and collect the guns? So I went to some meetings with a lot of officers and folks before session last year, and they were talking about, some of the sheriffs who were saying that just in one county, they have over 50 warehouses that are filled with nothing but guns that they can't do anything with. 50 in one county. And so they were saying that the resources that they would need to then go out and collect guns from people who already own guns.
That was the whole debate too, is do you collect them from people who already own them, or do you block them from buying a new gun?
And
or both.
How do you account for that? There's no system in Colorado currently right now that exists to track that. And then you've got people going into their homes. They were telling stories that they go knock on a door because of some other complaint. The guy turns out to be a felon, not allowed to have guns, and had 55 guns under his bed. They were not equipped to take that. And that's not something general public would probably do. I certainly never have. So just if that's one county, having to align that across our state would be really challenging. And where's the money going to come from? Who's going to pay for that? And is that the best use of our police officers' time?
Did you have another question?
Yeah. I was just curious if more like macro issues are brought up in those meetings, like masculinity and like violence in the media, and things that I feel like are like more large scale, I guess, than like maybe stigmatizing like certain people with certain mental illnesses. Just to me seems like not necessarily the right direction.
Yeah, that's an excellent question. And I think one of the things that happens a lot in the legislative process in the legislature is a bill gets introduced on a more narrow piece of a larger issue, okay? So this is a great example. Let's look at people with mental illness having access to guns. That is just one piece of the puzzle. And it doesn't lend itself very well to a larger discussion about the bigger issues. Now, I will say what does sometimes is a task force that gets appointed to look at it, who looks over it over a longer period of time. So the bill that came out of the elder abuse task force resulted from a bigger, broader discussion. And I think you can tell in the outcome. It wasn't just, let's do mandatory reporting. It was, let's do mandatory reporting with enough staff behind it to investigate complaints that come in, with collecting some data, with looking at things like financial exploitation. They have multiple meetings to talk about how you put that in the same bill with physical abuse and neglect. I mean, some of the mandatory reporters for elder abuse are financial planners, people that work at banks. I mean, they're not required to report child abuse or physical abuse and neglect, but they're had to be listed. And so sometimes when a bigger group meets over a longer period of time, and they're not necessarily bigger, but they meet over a longer period of time, and maybe the right stakeholders are in the room, rather than legislators who know very little perhaps about that particular topic that might be in front of their committee, then I have seen it result in some broader discussion. But this was one bill on one piece of the pie.
Well, and the reason that bill died is because of issues like what you're mentioning. So not those specific issues, but the whole piece around the stigma that's going to come out of mental health and what that means, what that looks like. And the talking point that was used over and over is you've got 1% of folks who have mental illness that then something like this happens. So why are we not talking about the 99% that don't? And so that was the talking points used over and over in testimony.
And then also I think, how do we know this is even going to make any difference? Is this really what leads to gun violence? So it was definitely some of that came out.
But it was people like all of us going and testifying that did result in something happening and a change being made. And Mental Health America is heading this up with the legislator that was looking at this. And they have been talking a lot about what this might look like and what needs to be discussed to actually perhaps address the actual issue. So the actual issue is sort of set aside, and now they're talking about all these surrounding points that are coming up. And so it may or may not come back through this legislation, but there is a group that has been meeting around that issue to talk about the root stemming issues that come out of that, more so than, yeah, we've got people with mental illness and some of them are making really awful decisions. So
There was also some, I think, valid discussion about someone comes into a hospital with a suicide attempt and is diagnosed with a mental illness through the care they receive. Does it make sense to limit their access to guns? Maybe. You know, maybe that person shouldn't be able to go buy a gun legally the next day. So, you know, these are tough issues that need to be weighed. I know that's a super hot topic right now. I just want to make sure with our last couple of minutes that we don't miss anyone who had other questions or topics they wanted to talk about. No? Yeah, go ahead.
Could you talk about what back to Medicaid again with this 12-month eligibility for kids? What was it before and what is it changing to?
Okay, so Medicaid has been based on a family's income, and what happens is on a quarterly basis, that income is checked again through a computer system that goes to the county. And if it shows up that the family is now not eligible for Medicaid, the child is taken off the program. Some counties don't look at it every quarter. Some of them aren't as active about taking people off, but families have been experiencing brief periods of Medicaid, which, you know, on the one hand, it's an income eligibility program. So some will argue that if the family is no longer income eligible, they shouldn't be on the program. But it wasn't necessarily looking at whether they had other health insurance for their child. And also the argument that had been made over many years by healthcare providers is that it's not a good way to provide healthcare to kids. They need to get regular healthcare, have that available to them when they need it. And what happens when you have that is you get a lot of pent-up demand. So you haven't gone to the doctor for an entire year, then you're eligible for Medicaid again. You get it for 3 months, try to get everything done right at once, and something may have been unmanaged or not taken care of over that period of time. So it is changing so that no matter what happens to a family's income, from the date that they're enrolled in Medicaid, the child will be on the program for 12 months. There's a couple of exceptions where if you get coverage, there's a way that you can drop Medicaid, but the basic idea is to make sure those kids have continuous health insurance.
Is that a Colorado thing or is that a part of?
It's not a part of the Affordable Care Act. Some states do it. Colorado's doing it in part because of the funding of the Affordable Care Act that provides more federal funds for the Medicaid program for some populations than we've received in the past. So the Affordable Care Act doesn't require it, but it indirectly has contributed to the money to make it happen. Yeah, the Child Health Plan, which interestingly is for kids in the next income category up, has had that for a long time, the 12-month continuous eligibility. So it also didn't really make sense to take your lower income kids and have their period with health insurance be less, frankly. So, yeah. All right, well, you guys have been great. Lots of good questions. I'm glad we had time for that. Thank you very much for coming. Is there anything you guys want to say in closing? No? Thank you. All right.